Hi, welcome to another Facebook Live with Veterinary Referral Center of Central Oregon. I'm Jen Bentley, and I also have Dr. Vaughn here today with me as well. And we are going to be talking about everything about anesthesia. And so we'll start off with just letting Dr. Vaughn give a brief introduction about himself and his background.
Yeah, hi everybody. So my name is Matt Vaughn. I am I'm our internal medicine specialist here. I've been in Bend, Oregon for about 3.5 years, and we opened up the place about 2.5 years ago. Originally from Philadelphia. I see most of my patients are geriatric patients with combinations of disorders such as kidney disease or liver disease or diabetes. And I also do some cancer therapy, but we're happy to hand that off to our new oncologist that started this week. So that's just a little bit about me.
Awesome. And Dr. Vaughn is a great person to be talking about anesthesia because you really do anesthetize a lot of older and very, very sick animals to get the answers you need or to do the treatments you need to do, right?
Correct.
Yeah.
Yeah.
So we're just going to start off with the basics and talk a little bit about the difference between anesthesia and sedation and why a doctor may pick one versus the other. And so you're very clear when you go to the veterinarian and you have a procedure that needs to be done on your pet, you know what they're talking about when they're saying anesthesia or sedation. And as always, feel free to write in. We've got Denali taking questions, so if you have questions, feel free to ask. And we've got Shelby, of course, on the camera back there as well. So Dr. Vaughn, you want to go ahead and kind of explain the differences between anesthesia and sedation and what's involved with both of those?
Yeah, in general, it's a matter of degree. So, I mean, we use anesthetic agents for all of these things, but sedation, even within sedation, there's levels of degree. So I may have a patient that I just need to do a good physical exam or do a very short procedure where we just need to take the edge off and they're totally conscious. We give a medication, like a pain medication, that just gets them a little bit groggy so that we can do what we need to do. They're less anxious and so there's that, they're walking around completely conscious. Then there's levels of sedation where they're not able to walk around, but they may be conscious but not feeling any pain or having any anxiety. And then with full anesthesia, there we give a systemic anesthetic agent, and then typically we maintain them under anesthesia with a tube in their airway where we're giving oxygen. Actually, I have one here. This is called the endotracheal tube. This goes in the trachea, and then we're giving oxygen with an inhaled anesthetic agent with it that keeps them at a good plane of anesthesia where they're breathing on their own, heart's doing great, but they're not feeling or conscious of anything that's going on.
I think that's a really good synopsis. And we already have one question.
Yes, we do. Susan Richmond would like to know, what do you do when a pet is having a bad reaction to the anesthesia?
Great question, Susan. We are always monitoring very closely for any type of reaction. And so reactions are uncommon to anesthesia, but things that we're specifically looking at are there any abnormalities with the heart? So are there any arrhythmias? Are there any issues with blood pressure that might be changed from anesthesia? And so we have, those are some of the more common things we might deal with. So we're ready to anticipate those needs, and a lot of it comes into properly screening a patient beforehand to see if they're at risk for anything like that, but then also being ready with either reversal agents for anesthesia to take away the effect of the anesthesia or sedation, other treatments to maintain their blood pressure if needed, or if there's a severe reaction to anesthesia, we'll stop what we're doing, wake them up, and support them that way. And I heard it's Fanny's birthday today or yesterday. Happy birthday, Fanny.
Yeah, that was a really good question. And I mean, from my experience, I don't do a lot of anesthesia, but certainly a lot of sedated procedures. And I don't have to do a lot of reversals of medications because I do think it comes into picking the right patient, knowing what you have to do, and having the right sedated or anesthetic protocol. And then I guess, is it true to say that, sedated procedures, is sedation more safe than anesthesia? I mean, is that a good generalization, or is it more complicated than that?
I think it's more complicated than that. It depends on what drug you're using, and so we typically, with every patient, we as veterinarians want to individualize our anesthetic protocol for that patient. So it's not we give every patient the same drug, but
right.
Hey, if they've got a history of some heart disease, we're going to avoid certain anesthetic or sedative medications to minimize any risk with that.
Perfect.
So in general, yes, sedation is safer than full anesthesia, but not always, and it depends on the patient.
And another question?
We do. We have a question from Sue, and she said, would you explain a reversal agent?
Oh, that's a good one.
Good
Go for
question.
it.
Well, it depends. There are different reversal agents for different drugs, and so there it might be an anesthetic drug that has an effect a certain way on receptors in the body, and then those reversal agents may take away their ability to bind that receptor or reverse some of the changes there. So you can go from a very sedated patient or one that was given a medication that made them more sedate than you wanted, and you can take that effect away very quickly.
And so we have a comment from Susan when we asked about reactions to anesthesia. And she said that as an older dog, the last time she had oral surgery, she came back very anxious and disoriented.
Yeah, I think that kind of leads us into our next question is what can we expect, as a parent of a pet going home after an anesthetic procedure at home? Is anxiety one of those things we can expect, and how much is too much?
Right, yeah, it is something that we watch for very closely, especially when they're first waking up from anesthesia. And if anybody of you have had anesthesia yourselves out there, you may have experienced it where you feel disoriented waking up, and they can feel that way too. And so we have medications usually on board. They're going to take away some of that anxiety as part of the anesthetic protocol, but we have other ways to give additional medications if needed for anxiety. The other thing we deal with recovery is always pain, and so pain control is really important in anesthesia as well. Heading into using a drug during the anesthesia that's going to take away pain, but also afterwards. I would say the recovery time for anesthesia depends a lot on what was done, and also the pet. Every pet is going to metabolize and get rid of anesthetic drugs a little bit differently, maybe having a little bit different demeanor of how anxious they may be. Most of my patients, it's a short procedure. We don't, I do a procedure like an endoscopy. You're looking with a scope. It's pretty quick. They don't have any incisions to heal. There's no pain. They're usually back to normal the next morning. Whereas a prolonged orthopedic surgery, we're going to be dealing with pain medications afterwards that might make them a little bit sedate, and so that recovery time is going to be longer in those patients.
And is there anything that our owners can do at home that, if they have to have their pet undergo a procedure, is there anything you would recommend that they would ask the veterinarian to ensure that they are getting the best care, or kind of, I know that may be a hard question, but is there anything you would be like, I definitely want them monitoring for this, or doing anything like that?
I think the most important thing is anesthesia it's very safe. The level of risk is quite low, but it's there in every patient. But there's certain patients where that risk level may be higher. And so asking your veterinarian, are there any things with my pet that are red flags or indicators that we should be more cautious than others? And that depends on the pet, depends on the age of the pet. So that's where things like pre-anesthetic screening, so blood work to see if there's kidney disease or liver disease, or is there any heart murmur or heart arrhythmia, knowing those things. So asking your veterinarian, are there any specific concerns to my pet in regards to the procedure or the anesthetic that we should be aware of? And if so, what are we going to do to minimize the risks associated with that?
Perfect. And if you guys are just joining us, we are talking about everything about anesthesia. So feel free to ask questions and join the conversation here. And I think I have one last question. I always get from my owners, they're like, oh, I have an older dog. I don't want to, put that through anesthesia. But I think going back to what you said, it's really very individualized. Just because they're an old dog doesn't necessarily mean they can't be a good anesthetic candidate.
Correct. Yeah. I mean, age itself is not a reason in my mind not to do anesthesia, but along with age can in not every dog or cat, but can we see a higher incidence of things like kidney disease or heart disease. And so that's where that pre-anesthetic screening becomes more and more important the older they are. you know, the classic would be, we don't want to get their teeth clean, but if you wait for 5 years and don't clean the teeth, now if they're going to get clean, it's going to be a really long procedure that in an older pet that you want to avoid, where it could have been a shorter one if we had done and stayed ahead of it.
Any more questions back there? All right. Well,
We just have one more from
One
Susan.
more. Great.
She said, in regards to recovery period, how long for a dog over 10?
I would say once again, you know, I as an internist, most of my patients are over 10, and most of them are back to completely normal the next morning. But that's a short anesthetic with a short procedure where there's no procedure-specific recovery along with it. So that's not uncommon. And you know, even with sedation, maybe a little bit tired that night and back to normal the next day. Others may take a day or two. I would say anything more, unless they had pain medication sent home with them or other medications that might be causing some sedation or changes, anything more than a day or two would be unusual in my opinion.
All right, well, thank you so much for joining us on Facebook Live. We're going to be here again, same time in 2 weeks on Wednesday. So feel free to join us there. And if you like this video, please give us a big thumbs up.